The Therapeutic Goods Administration is assessing an application from Pfizer to register its COVID-19 vaccine for use in children aged 12 to 15. The vaccine is only approved for use for those 16 and older in Australia, but in the US, UK and Canada, children aged 12 and up are already receiving them. To discuss this, I'm joined by Dr. Andrew Miller, a West Australian anaesthetist and spokesperson for the West Australian Medical Association. Dr. Miller, thank you so much for your time. Do children need to be vaccinated against COVID-19?
Well, yes, we hope so, and we fully support the TGA and ATAGI process for approving vaccines in Australia. It's a really exciting time to see adolescents being vaccinated in other countries and studies being done on younger children because we know that this is not a benign disease in children, and we think it's a really important conversation to have as we see this sort of rollout has had its bumps along the road, but very exciting to see we're going to get big supplies of vaccines soon. And with the pressure to open up, we'll need to have that very important conversation around, well, what about the kids though? What's happening with them?
What do we know about the safety of vaccines for children?
Well, we already have an incredibly successful and very safe vaccine program, thanks to ATAGI and the TGA having kept a close eye on that. And we won't want to jeopardise any of that confidence. We'll want to see all of these vaccines go through appropriate trials. But knowing they're already being used overseas is a big advantage for us, although we're obviously behind others in being able to get to the stage of thinking about opening up. We do have the advantage of all that worldwide experience. So want to draw on that to avoid the problems of not just the acute disease, which can unfortunately kill some children and make them very sick, although it's in very small numbers, thankfully, it still is very real. And the issue of long COVID as well, which of course they have a lot more years to live. And so we want to be sure to avoid that long-term disability. So we're really hopeful that these vaccines will be proven to be safe in children. And we want to have that conversation now about the expectation that when they're ready, how we're going to roll them out.
In the United States, where mRNA vaccines have been given to children since May, there have been reports of mild chest pain or other signs of possible heart inflammation, known as myocarditis, in a small percentage of teenagers and young adults. What more can you tell us about that?
Well, yeah, we're watching those reports with a great deal of interest, and I think that the example of AstraZeneca has been a good one in Australia, and the public can have confidence that we do have real-time monitoring of these issues, and the ATAGI have been very honest in coming forward and saying, look, we'd rather no longer use this vaccine in people under 60. And so taking all this information that we get from overseas, the issue around myocarditis seems to be a transient one that we're seeing so far, and certainly a lot less problematic than long-term COVID in children, which can, of course, cause the same problem. So we will have the advantage of all of that information. And I think that we just need people to be letting their politicians know that we really want to get away from lockdowns. We really want to get away from this disease, but we're not prepared to do what the UK is doing, which seems to be that they're just accepting the fact that all of the children are going to be infected before a vaccination is available.
So some parents might argue that we don't know enough about the long-term effect of the vaccines on children, and because they don't seem to suffer serious illness in mass numbers as a result of the virus, that we shouldn't be vaccinating them just to protect older people. I realise that's a provocative question, but it's one that parents are asking, and it's not necessarily based on any anti-vaccine sentiment.
No, and I think it's very reasonable to ask questions like this, and we can reassure people that none of the vaccines used in the past has had any long-term effects. In fact, we see all of the adverse effects of the vaccine in a very short time frame following their use. And so that's one way to be reassured. Another way is to understand the biological basis of vaccines is much safer than the biological basis of viral infection, and we can point to having accepted in my childhood that diseases like chickenpox and mumps and even measles to a degree would go through the population. But now that they've been eradicated, we're not seeing the long-term effects of those diseases, and we certainly have no long-term effects from all of those vaccines. So we've eradicated that problem of the virus, which is always bigger than the problem of the right vaccine.